Okay, I'm going to record a simulation today of inpatient setup, okay? And it applies, most of it applies to the outpatient setup too, and I'll explain a little bit about the outpatient setup as we go along, but this is mainly the inpatient. So the inpatient's going to be in a sort of a bigger bed, where outpatient's probably going to be in a gurney or a reclining chair. But for this simulation, we're gonna act as though we're coming into a patient's room. Okay. So before you go into the room, you either want to gel or wash your hands. Okay. And then you come on in and you have your paperwork with you, because you need to identify the patient. So you pull the machine in after you, and I usually come in like this, and I usually, leave the machine kind of by the foot of the bed, and I introduce myself, and I'll say, "Hello, are you Mr. John Doe?" And they usually acknowledge yes, and you can say, my name is Ralph. I'm from the EEG lab, and I'm here to do your test." And you can say, the neurology team ordered the test on you, and so I'm going to do it while you're lying here in your bed, right at the bedside. And then usually they acknowledge it, and they're like, okay, because a lot of times these patients, the nurse will tell them that, that they're coming to do the EEG, or the neurology team tells them that they're going to order the test. But usually you want to get an acknowledgement, and they'll say, yeah. And then you just go into your spiel. You say, okay, the test is real easy and safe. What I'm going to do is I'm going to measure on your head and map out the locations for these round little discs that I'm going to place onto your scalp. So after I map them out, after I measure and map them out, I'm going to take a Q-tip, and I'm going to exfoliate your skin with a prep gel. And then I'm going to take the electrode and put some electroconductive paste on it, and then just stick it right to your scalp. Okay. So the test is, painless, and it's very safe. But what we're going to do then is I'm just going to have you close your eyes and rest while we record the electrochemical activity coming through your skull from your brain. Okay. And then usually they say, oh, okay, all right. So, and then what you do is, before you start, you look at your requisition, and you find the patient's wristband, and you confirm you confirm that that's the patient, so it should match your requisition. Okay, so you always want to do that. You never want to start a test without confirming that that's the patient, because a lot of times, sometimes these patients are confused, and sometimes you just orders get crossed, or you go into the wrong room or something like that. So you always want to confirm. Okay. And then they'll say, okay, fine. And then what you do is you bring your machine in, and then you just say, okay, I'm going to get set up here. It's going to take me a few minutes. Okay. So basically, you just take your machine and you bring it in. And I like to bring it to the side of the bed, more towards the foot of the bed, and I leave a little walkway through here so I can get in and out towards the patient. And then I plug the machine in, and then I start it up. Okay, so the machine will boot up. So the first thing I'm going to do is I'm going to actually put in the patient file. So you have to make sure, on a Natus, you have to make sure the preamp cable is plugged into the head box, or else the file won't start. So here's the login screen. I'm going to log in. And then I'm going to hit new. And I'm going to put John Doe or whoever. And then you can fill, if your site may have you fill in a bunch more stuff on the actual initial patient information page. And at Encinitas, Sarah and Susan are coming there, and we actually have, you know, we'll have you guys fill in more information, but I'm just going to put in the first and last name right for now. And then you click start, and then it'll open up, and then it'll start scrolling across, and you want to make sure it's not recording, okay? Otherwise you're going to have, you know, 45 minutes of data before you're done hooking up, or 30 minutes, whatever. And then what I do is I put the impedance meter on, and I just let it sit there, okay? The next thing I do is I pull the bed out. So I just say to the patient, okay, I'm going to pull your bed out and raise it so I can, you know, I can get in a good position to hook you up for the EEG. So you just kind of explain to them what you're doing, and then you just pull it out. Okay, and after you pull it out, you know, you want it, you know, a couple feet from the wall so you can slide in like this, okay? And then you have to lock the bed, okay? And also, you want to make sure that the bed rails are up, okay? Because we're going to raise the bed to a high position, way up, so you don't have to bend when you're actually hooking up. So basically what I do then is I raise the bed up like this. I usually get to a point where it's like right here, so I'm not bending over like this. Okay. Now the bed's pulled out. It's locked. The arm rails are up. The bed's up and, you know, has been raised up. Now you want to actually, you know, gel your hands really good or wash them before you put your gloves on, right? Always wash or gel your hands before you put your gloves on. And then you put your gloves on. And then you go over to the patient and you say, okay, I'm gonna put a towel roll behind your head, and I'm gonna take your pillow out and put a towel roll behind your head. So basically, I have two towels. One is in a roll. I have one in a roll, and I have another one, so I can put it at the head of the bed so I don't get the head of the bed all soiled. Okay. So I help, you know, I kind of help them hold their head up like this. And I pull the pillow out, and I usually put it to the side like that. And then while holding their head up, I usually help them unless they can do it themselves. Just depends on the patient. They'll let you know pretty much. But, you know, you just ask them, or, you know, if they can raise their head, or you can help them, either one. And so now you have this down. You have it, so you can lay your stuff out on this here without getting the sheet all dirty. And then you have the towel roll behind there. And then what you do is you take your gloves off, and you gel your hands. You go gel your hands again, or wash them, whatever you want. Okay. And the reason you do that is because you've touched the patient's body, right? And then you don't want to go over and touch your supplies, because they'll get all contaminated, your supply box. So now I gelled my hands, and now I just go and I grab all my stuff. I grab my electrode box, and I just put my electrode box down. You want to make sure that your electrodes don't touch the floor, okay? And so usually I have little clips on our jack boxes, and I just clip it to the towel like that. Make sure your leads don't drag on the floor, because they'll get contaminated. And then you just you get all your prep stuff together. So I have I bring out my paste. And you can put it, you know, you can organize it in whatever way you want that's best for you. My prep gel, and I have my little patches. So I put those aside until I need them. I have my Q-tips, my measuring tape, or I'm sorry, my grease pencil, and my measuring tape. And I like to, I also take I always wrap my patients with a gauze wrap. So I leave one of these here too, okay? So now you're ready to actually measure. So what you do then is you either gel or wash your hands, and then you get a fresh set of gloves, put them on, and you come to the patient and you say, okay, we're going to get started measuring now. And then you just come behind and you have everything laid out here, and you just go ahead and do your thing like you've been doing in class, okay? So you just do the measurements, okay? When you're measuring, just make sure, you know, when you have them move their head, just say, okay, can you move your head to the left? And don't push their head like this. Just gently guide them with your hands. You know, if you just put a light little pressure on their head, they'll do it for you. You don't have to push it for them, okay? And then, so you just go ahead and do your measurements, okay? In the outpatient lab, you're probably going to have a gurney, which is going to be much narrower like this. It's not going to have all this extra space on the side, or you're going to have actually like a recliner or something like that. So what you want to do in that case, all the prep supplies, you need to have like a little table on the side, and you put all your prep stuff right there. And then you kind of squeeze your jack box in somewhere behind the patient and attach it to a towel or the sheet so it doesn't fall on the ground, okay? And then basically what you're going to do is you're just going to take your stuff from the table and do your application, your measurements, your prepping and application, okay? There's a couple other things that I wanted to explain to you about the inpatient setting, and it has to do with 60 cycle, okay? And also the outpatient setting too. But this cable here that goes to the jack box, this preamp cable, you don't want it crossing over any power cables from the EEG machine to the bed. So if there's a power cable on the floor, let's say like the bed is plugged in and it's running underneath this cable, just push it out of the way and make sure that it's not lying over that power cord, because it'll cause 60 cycle in your EEG. Also, if you do that and you turn on your EEG and you're getting 60 cycle, there's 3 things you can do to eliminate the 60 cycle, okay? First is to keep this cable off of any power cords, okay, this preamp cable. Second, you can unplug the bed from the wall, okay? It's up and it's locked. It's not going to fall down if you unplug it. So you turn on your EEG and you see like 60 cycle. You can stop the recording and you can go over there and unplug the bed, and then you go back to your EEG. If the 60 cycle's gone away, then that's great. Then you can just start your recording, okay? If that doesn't do it, there's another thing. There's another device that causes lots of 60 cycle, and a lot of inpatients, since they're staying in the hospital and they're bedridden for sometimes several days, they'll put these compression pads over their calves to prevent clots. And so their legs will be wrapped with these compression pads, and then these little tubes will go to this little unit that's attached to the head of the bed. And then that unit is plugged into the wall, usually with a black, like some black cable. So what you can do is you can unplug that from the wall, okay? And then you can go to your EEG and see if the 60 cycle has disappeared. If it does disappear, that's great. And then you can just go ahead and record. And you can leave it unplugged for a little while. But you have to make a note to yourself before you leave the room. You're gonna have to plug those compression stockings back in, okay? Also, you'll remember to plug the bed back in because you gotta lower the bed back and put it back in the position it was when you came in the room, okay? And if those three things don't work, if the patient has like an IV, you can unplug the IV for a little bit to see if that eliminates the 60 cycle, okay? But because they run on battery, they have a limited time of battery power. But if that eliminates it, then just type in there, okay, unplugged IV, 60 cycle disappears. But then you have to plug it back in, and then you start recording, and then you turn your 60 hertz filter on, okay? So you always, if you get 60 cycle, always think about those things before you start recording. Try to eliminate it. And the last thing that could cause artifact is like other machines, like a like a body warming device. There's all sorts of things that can cause 60 cycle. Sometimes they're doing dialysis. There's a lot of things that could be hooked up to the patient. You know, the monitors from the monitor, like the vitals monitor. But those three things you can try to eliminate it, and fourth thing you can try the IV thing, but you have to plug that back in right away. If you can't eliminate it, then just turn your 60 hertz filter on then in that case, okay? One last thing, if you're in an inpatient room and the patient's intubated, so let's say you're on this side of the bed and the tubing from the patient's throat comes up this way to the ventilator over here, and let's say there's some IV lines coming to an IV over here too. What you do with the head box is you never want to lie it over the top of the tubing, okay? You don't want to lay it over the top. You want to go underneath all the IV tubing and the respirator tubing, the intubation tubing. So you go under all of it and then bring it up this way. So that way it'll be hanging below all the tubes and the cables, so it won't be touching them to collect artifact. And then again, you want to make sure that this cable here doesn't lie over a power cord, okay? And if you do those things, that's the best you can do. But you just want to isolate, your cable and try to eliminate the 60 cycle as best you can. If you can't, then just turn on your 60 hertz filter and that'll take it away, okay? And then when you're recording, let's say she's all hooked up, or he's all hooked up, you remember in class, you just bring the machine up close to the bed like this, and then you're looking at the patient here, and you're looking at your screen here. So you can turn your screen a little bit. Now all you have to do is you don't even have to turn your head. You could just turn your eyes a little bit and look at the patient, okay? So when you're recording, most of the time, you should always pay attention to your patient, okay? Especially in the beginning, you want to observe the patient. But and also, you want to stimulate them a little bit at the beginning to check for their alertness, their highest level alertness. But then if they settle down and they quiet down, they fall asleep, then you don't have to look at them so much. You can turn your attention to your EEG, and you can go ahead and put in a little bit of history. But when you're typing, you always want to make sure that your mind is kind of aware of your patient. You don't want to totally forget about them and just totally have your head right in your recording. You always want to keep your mind on your patient, okay? 90% of the time, the patient's not going to have a seizure, or maybe even 95% of the time, you're not going to get a seizure out of your patient. But at the least unexpected time, they'll have a seizure, and you don't want to be just sitting here and then the seizure's already 10-20 seconds into it, and then you notice that the background is changing. So you always just want to be aware, I'm going to be typing the birth date 1960, I'm sorry, that's my birth date. And then you're putting in this information, but then I'm looking back, and I'm looking at the back of the screen so I can see the stuff scroll, and there's no changes, so I keep typing, okay? So you're gonna get really good at this. You're gonna be able to put history in, you know, someday in the future, you're gonna be able to observe and do the history, you know, and get everything in. I'm gonna put in, you know, some more information. I'm looking at the patient, you know, and I put in the information that needs to be put in. Okay. All right. So I'm looking at the patient a little bit, looking at the back of the screen. Okay, so I got the first, the first page filled out. So I click it off a little bit, and then I turn my attention to the patient a little bit. Remember, it's always advantageous to get sleep on your patients. So after you initially, alert the patient to establish their fastest alpha rhythm and their most alert state, then let them fall asleep. Most doctors, reading doctors like to see sleep, okay? So you don't have to bother them after that initial 5 minutes where you ask them questions. And then, then you can shut it off, and then you just look for a little bit, and then you go back and turn it back on again. You pop in your medications, whatever they might be. Okay, so this is all done very smoothly and it's actually quite a nice flow. When you first start, you probably have so many things on your mind, but then you can concentrate on the history a little bit. We're going to go over history. You don't have to put in so much, maybe 2 to 4 lines or something like that. But then you can fill in all the information that your site wants you to fill in. So, and I'm just keeping my eye sort of on the background on the patient while I'm typing here. So you can see how easy it is to do this. And like I said, most of the time the patient's not going to have a seizure, okay? It's very rare. But if they have some, spike and wave discharges or something, like just brief ones, you want to kind of be alert to that. If they have one and you miss it, that's okay. Just if let's say they had a spike and wave and you didn't quite see it, then just shut it off, and then observe again. So if they have one spike and wave, they'll probably have another one. So you can observe for a while. If they have another one, then you're watching them, and if you don't see anything, you could just put, no clinical signs or NCS or something like that. If the patient has or if the patient jerks or something during the discharge, then you just put body jerk or arm jerk or whatever, okay? But anyway, you'll learn how to do that as you go along, the more EEGs you do, okay? So let's say we did the recording and we're all done with the recording. By the way, after I'm done hooking up, I'm taking my gloves off and gelling my hands before I go back and record. I didn't do that. But anyway, let's say you're all done recording. Oh, by the way, the tapes, I forgot to put the tapes out, but I usually put the tapes like right on the bed rail like this. Just like that. So when I'm, then when I'm putting on the eyelids, I just grab them real quick, put them on like that. So when you're done, you close out of this, and then you're not going to have gloves on, of course. Then when you're done, basically what you do is you wash your hands again. Okay, you put on a fresh set of gloves, and then you tell the patient, okay, we're all done. I'm going to get you all cleaned up, okay? So besides the two towels that I bring into the room, by the way, the towels are always going to be white in the hospital and in the outpatient setting. The towels are always going to be white, and the washcloths are always going to be white too. So before you go into the room, you want to, you can get whatever you feels good to you for your setup. I bring in two towels. I bring one towel for a towel roll, and then I bring one to lie on the head of the bed so I don't get it soiled. And then if they're really tiny towels, sometimes you'll get these really skimpy towels. I'll use two for the towel roll. And then I usually bring in 3 washcloths. 2 of them I wet down to clean the head, and the other one I use to dry the head, okay? So you can just say, okay, we're done with your test. I'm going to clean you up right now. And so you just, if these are disposable, you just take them out of the jack box and throw them in the trash. If they're not disposable, what you can do is you take the ends of them. If they're reusable and you have to re-clean them, you take the end like this, and you pull them through your glove like this, okay? Okay, so now they're in the glove like that. Then you could just go ahead and put another glove back on. And then you take this off here. You can just put it in the back of the machine. And then you take all your supplies, all your dirty supplies, and you just throw everything in the trash, okay? And then your grease pencil you put on your EEG machine, because you have to clean it before you put it back in your box. And then you just tell the patient, okay, I'm going to put the pillow back under your head. Oh, the patient's head, what you should do is, before you put the pillow back, you're going to wipe the cloths down. Of course, you're going to want to get them saturated with warm water, because warm water actually cleans the scalp a lot better than cold water. So it's really quite a stark difference. So you clean the head up with your wet washcloths, and then I just leave them here on the side, and then I take the dry one and I wipe off the head. And what you want to do when you clean, you want to go over each individual electrode site and clean all the paste off. You don't want to leave any paste in the hair, okay? You want to do a real thorough job cleaning the scalp up. You don't want to leave paste in there. Some of the red grease pencil is going to be stuck on the hair shaft. That's okay, okay? But on the scalp, you want to get all the grease pencil and the paste off. And once you get everything cleaned up, if their hair is combable, take a comb and just comb through the hair really nicely, okay? And then you just say, okay, when you get a chance, or when you get home, or whenever, the nurse might be able to help you out too. You need to take a good shampoo, because there's going to be some residual paste on your hair shafts and grease pencil markings. And they usually acknowledges that, okay, they'll say, okay, most people don't care. And then when you say that, then you say, okay, I'm going to put the pillow back under your head. So now you leave this here, and then you just kind of roll this up like this. And you take the towels, you can just rest the patient's head down, and you have like a bag, a blue bag, a linen bag available, or there'll be a soiled linen bin in the room. If they don't have a soiled linen bin, you have to get a blue bag for soiled linen. You put it in there, and then you take the bag and you leave it in the bathroom underneath the sink. So the cleaning crew, when they come in, they'll see it and they'll take it away. You can never take soiled linen outside of the room into the hallways with your gloves on. Okay, you can't do that. So you'll have, if they don't have a soiled linen bin, then usually you can find the bags at the opening of the door, and you just grab one and put it in there. If not, then you'll have to get one from the soiled linen closet before you go into the room. Okay. And then, you give them their pillow back, just help them guide their head up, and they'll help you. You put the pillow back underneath like that. And then, basically what you do is you unlock the bed, and you push it back towards the wall. Not all the way though, because when you lower it, you don't want it dragging against the wall. Just leave a little clearance on the back. And then lock it. And then lower the bed, okay? So you want to lower it all the way down till it stops, okay? And then you just leave the side rails up, okay? So you lower it all the way down. Okay, I'm gonna take my tape away. Okay, and then you can take your gloves off, and then you have to gel your hands again every time you take it off. And then you come back to the patient and you say, okay, we're all done with the test. So the doctors the neurologist will read your test in a little while, probably a couple hours or so. So you'll probably know the routine at your hospital or at the outpatient clinic. But you just tell them that the test is going to be read. So if it's an inpatient, you could just say, the neurologist will read your test likely by the end of the afternoon, or whatever you'll know the habits of your reading doctor. And then you can just ask your nurse for the result, and the nurse will actually once the doctor posts it in the EMR, the nurse can look it up for the patient. Or she'll look it up and then she'll call the doctor to come talk to the patient. Okay, this is inpatient. If it's an outpatient, then you just tell them, okay, your doctor will probably read the test within a day or two, but you can follow up with your doctor on Follow My Health. Sharp has Follow My Health, so it's a web-based system where you can schedule your appointments. Or they actually, when you schedule appointments, you can go in there and you can see all your appointments, and you can see a bunch of other stuff too about your medical health. But you can also communicate with your doctor through these web-based charting, systems. So Follow My Health is Sharp, and UCSD is My Chart. So you can just say, if you want, you can send your doctor a message telling him that, you finished the test, and maybe he'll get back to you, okay? But you can expect probably 1 or 2 days before your results are available. And again, your reading doctor's habits. So, you can be, if you know a certain doctor usually reads with the same day or the next day, then you can be reasonably assured that their test will get read. And then you just say, thank you very much for your cooperation, okay? And then you just go ahead and then you take your machine and you go out towards the door. And at the door, there should be some cavi wipes and some sanitary wipes like we have in here. And what you do, at Scripps, they clean their machines from a top-down method. So basically what you do is you put your gloves back on, okay? You wash your hands, put a new set of gloves back on, and then you wipe from the top down. You can start on the camera, just kind of brush off, and then you get to the keyboard and the desktop, you wipe that down, and then you go in the back and wipe the handles. You wipe down the preamp cable and the power cable with the sanitary wipes, and then you go down and wipe the computer off and down towards that. So you start from the top and work your way down, okay? And then before you leave the room, you take your gloves off, wash your hands really good. Oh, also, you can also, when you're doing the wipe down of the machine, you can wipe your pencil down really good. And usually the contact time is only like a minute for the Cavicide wipes. So you can wipe it down really good and then just let it dry. And then once it dries, you can put it back in your box. And then the head box, you just want to be careful. You don't want to get anything inside of in jacks, because if solution goes down in there, it'll rust them and it'll ruin the little components in there, and it'll screw up your jack box. So what you do for that is you take the wipe and you just brush it really good. You know, just brush it off, and then just dry it real quickly after that. You don't want to soak your head box with Cavicide wipe, because it'll eventually drain down into these little inputs and it'll ruin your jack box. So I'm a little less stringent with that, but I'm going to show you a method here very shortly on how to, you know, keep this thing a little cleaner than you ordinarily would if you just pulled each one out individually out of the jack box. And that's it. Basically, if it's an outpatient, then you're going to pull all the sheet. The patient's going to leave the lab. You're going to pull all the sheets off. You're going to wipe the bed down and the railings down with Cavicide wipe. You're going to wipe. You're going to throw all your supplies away, and then you're going to wipe down the tray table. You're going to wipe down your head box. You're going to clean your electrodes, or you're going to throw them away if they're disposable. And then, you know, you let everything dry, and then you put sheets back on. You prep the room for the next patient. Okay? So I think that's it. So if you have any questions, you can just email me or talk to me in class.